Good morning, everyone, and thank you for joining us. I'm Sonya Canzian, Executive Vice President, Clinical, People, and Chief Nursing Health Disciplines Officer. On behalf of Tim Rutledge, President and CEO, it is my pleasure to welcome you all to St. Michael's Hospital, a site of Unity Health Toronto, for this exciting announcement. I want to start off by extending a special welcome to our special guests today, the Honourable Minister of Mental Health and Addictions and Associate Minister of Health, Yara Sachs, the Honourable Minister of Women and Gender Equality and Youth and MP for Toronto Centre, Marci Ien, and to our Chief Nursing Officer of Canada, Dr. Leigh Chapman. We're thrilled to have you all here to share an exciting announcement. Substance use and addictions are a growing challenge in communities across Canada. Our own Unity Health MAP health research has shown increases in drug-related harms and deaths throughout the pandemic. It is a priority for Unity Health Toronto to address these substance use and addictions challenges and find innovative solutions. In the past 3 years, we've appointed an inaugural medical director of addictions, published high-impact research and reports on the opioid epidemic and other substances, oversaw the analysis and reporting of more than 11,000 drug samples by way of Toronto's drug checking service, an essential public health service. The majority of these initiatives wouldn't have been possible without the support of Health Canada. We look forward to continuing our work together to provide care and find solutions for those who face substance use and addictions challenges. With that, I'm pleased to introduce Minister Ien to the podium.
Sonia, thank you so much, and good morning, everyone. Hello, bonjour tout le monde. So happy to welcome everybody to Toronto Centre, the riding that I represent, and really it is the honor of my life. Avant de commencer, je tiens à souligner que les terres sur lesquelles nous nous réunissons font partie des terres et territoires traités de Mississauga de Crédit, and we acknowledge the territory of the Anishinaabe, the Huron-Wendat, the Haudenosaunee, and the Ojibwe, Chippewa peoples, and of course, the Métis peoples. We are here to speak about an issue that has impacted communities right across this country, of course, including right here in Toronto. We're talking about our neighbors and friends and family. Families torn apart, young people falling victim to addiction, people on the streets sleeping there because they're battling addiction. We know that people from equity-seeking communities, from lower income communities, are disproportionately impacted. And our hearts are broken, but it's not just about broken hearts, it's about taking action. Today is about a renewed strategy and about investing in organizations that are doing such important work. I want to take a moment to highlight the work of one of these people on the front lines. I literally met him on the streets one day on Parliament. And his name's Nick Rondinelli. He's the owner of Heart to Heart Foundation. And Nick's organization is one of the largest Red Cross training partners in Canada. And he actually runs courses. Our office and so many other orgs have taken them for opioid response. He does training, he distributes free Naxalin kits for vulnerable populations, and he does this on a daily basis. It's his life's work because he lost his best friend to addictions. This is an example of the types of life-saving projects that this renewed strategy will support. I want to close by mentioning that as Minister of Youth, tackling this issue is not just top of mind, it is everything, because I see it every day as I walk these streets. We need to make sure that our young people aren't falling victim to addiction and that we continue to take action, which I know Minister Sachs is absolutely committed to doing. So without further ado, I am so proud to introduce my colleague, but more importantly, my friend, Minister Yara Sachs, Minister of Mental Health and Addictions and Associate Minister of Health, to tell us more about the steps we're taking today to address this.
Good morning, everyone. I want to thank Minister Ien for welcoming me to Toronto Centre. We've walked a long journey together these last few years with a relentless passion for our communities, to women, to moms, stepping up to really fight the fight of our most vulnerable today. And I'm so proud to have her as a partner in this work for our youth and for those who are struggling, who are so many people that we love. But thank you for the warm welcome and the warm introduction, both from you and from Unity Health. I would like to also take a moment, thank you for the land acknowledgement. These are sacred lands that we share, that are places for growth and for healing, and that we have so much to learn from our Indigenous communities, First Nations, Métis, and Inuit. And we travel this journey together in the unceded and unsurrendered territories that we are privileged and humbled to share with them. I'd like to thank Unity Health Toronto, Sonya, and the team for their warm welcome and having us here on what's really an important day and an important announcement. I'm really so grateful for everything that you're doing to support the health and well-being of this community. You know, it says it right there, caring hearts, learning minds. It takes a certain amount of courage and bravery and the boldness to step into these spaces to help those that are most vulnerable. And the work of Unity Health, which I've experienced firsthand, particularly during the pandemic, is one that sees our communities exactly where they're at and is willing to roll up their sleeves and do the work to look at the problems and find the solutions, to ask the questions that not everyone asks when it comes to healthcare for our most vulnerable, especially those for equity-seeking communities. And here, Toronto Centre is really one of the key areas of that. I also want to thank all the other organizations and stakeholders who joined us here today for today's event and the announcements. The work you do is relentless. You do it every single day. It's inspiring, it's compassionate, and it's essential healthcare, essential to helping those who are most vulnerable and helping us to save lives. Because as we know, Canada is facing the most serious public health crisis in our country's history. And your work, each one of you and your organizations, are helping those and supporting those who are struggling and feel that they have nowhere else to go. And that work is critical. Everyone needs to have somewhere to go. Everyone needs to know that they can encounter primary health care that is safe and that is supportive. And each one of you who are here, and so many more of you who are doing this work, you are the experts. You know, you are out there every day. And in my role as Minister of Mental Health and Addictions, it's my job here to be here and to learn more about what you're doing and what more needs to be done and how we can help you, all of you, do that very important work. Since becoming the Minister of Mental Health and Addictions, I've heard from Canadians across the country about how substance use and mental health challenges have shaped their lives. There is no question that these challenges are taking a tremendous toll on individuals, their families, and their communities, whether it's someone's best friend, whether it's a sister, a brother, or a loved one, coworker, neighbor. We all know someone. And what we do know is that we need to use every tool at our disposal to address this, because it is a public health crisis. But we also need to do it with compassion. We need to do it with caring. And we need to prevent substance use related harms and know that we need to intervene early. We need to reduce the risks of substance use, and we need to connect people to care, to treatment, and to social supports like housing. Because without an integrated approach, without a holistic approach of all the social determinants of health, we can't ensure a continuum of care. And there's so much more to be done, not only by one government, one community, or one family, because siloed, we can't tackle this on our own. No one can do it alone. We need to do it in an integrated and holistic way. And that's my priority as the minister, to advocate and continue for an equitable, comprehensive, collaborative, compassionate, and evidence-based approach that supports what you are already doing, which is to reduce harms and save lives. One of the most important ways that we're doing this right now is the tools that we're able to provide in supporting communities through community-based projects. organizations like the ones that are here with us today. Each one of your organizations has deep roots in communities. You have trust, the trust of your clients, and you also have firsthand knowledge what's needed to make a real difference in their lives. So I'm really, really happy today to be announcing that our government is providing more than $21 million in federal funding for 52 projects across Canada through Health Canada's Substance Use and Addictions Program, also fondly known as SUAP. These investments are going to do some pretty amazing and incredible things, whether it's in BC, the Alberni Valley Drug and Alcohol Prevention Services Society, which will be delivering prevention programming and intervention services for 450 youth aged 10 to 22. Or some of the many other projects that are, it's a long list to go through. But I can say personally, as a mother to 2 teenage daughters, I can think of no better place than to focus our attention on our youth. And I am really pleased to have Minister Ien and a partner in supporting and empowering and bringing our youth to a healthy, safe place. And here in Toronto, the Neighborhood Group Community Services setting up wraparound health services, workshops, group services, and so much more for people who use drugs in the downtown core, expecting to serve hundreds, if not thousands of people. The ripple effect of the impact is tremendous. Each life that we help, each person that we help, helps someone else too. Je pourrais parler toute la journée du travail extraordinaire que nous soutenons avec des organisations qui assurent la sensibilisation, l'engagement et le traitement des populations vulnérables souffrant de troubles liés à l'utilisation de substances et de troubles concomitants. I could talk a lot about so many of these projects and the amazing work that we are supporting and that you do, and the many organizations who are involved in outreach, engagement, treatment of vulnerable populations, offering those primary care and other services for those who are experiencing substance use disorder or concurrent disorders. It's a long list of great work being done and a long list of Canadians who need that help. But one thing is certain, that all of the projects announced today are a great gateway to health and social supports that might otherwise be difficult to access. I look forward to seeing the outcome of these projects, and I want to thank all of you for this work because, frankly, we couldn't do it without you. Today's announcement, though, also includes all of our work. Today's announcement is included in a broader picture because it's guided by a plan. And it's a clear set of priorities that we are working toward with our partners. So in addition to today's 52 projects, I'm also presenting Canada's renewed Canadian Drugs and Substances Strategy. The strategy is a whole of government initiative. It is supported by 15 federal government departments and agencies, and it outlines our government's approach to addressing substance use and will guide us as we work with our partners. Many of them are you. We are working to decrease both supply of and demand of toxic and illegal substances, reduce harms when they are used, and prevent drug dependence. That's why we are leveraging all the tools at our disposal to work towards an end to this national public health crisis, including prevention, harm reduction, treatment and recovery, and enforcement. We also know that our approach has to address substance use as a health issue first and foremost, because while we balance public safety priorities, we have to remember at the center of all of this are people who need healthcare. And while I understand there are promising early results from safer supply projects, including declines in emergency department visits and hospital admissions, I'm also aware, as we move forward, that there are concerns being raised by some potential diversion. We know there are questions out there. We know there are, and we'll address them, but we will also ensure that there is a responsible, health-centered approach to helping those who need our help. Please know that I take the concerns seriously with regards to this bold work that we're doing, but the department is working closely with us so that we can ensure that safer supply is available, but also that diversion is something that we have front and center in the work that we do. Because we need an approach that is balanced, that is invested in evidence-based actions, and while also monitoring and learning from the innovative action required in the face of the public health crisis. So as I said before, we need to be bold, we need to be brave, we need to be driven by the evidence, but we also know that we need to see people at the forefront of this. You'll be hearing more about the work we are doing under the strategy in the coming months, and I'll be excited to share our findings with you and the work that we'll be doing together. Every person who uses substances is on their own path and has unique needs. We need to see them, really see them. We need to be there for them, to be able to help them, and we need to have a full set of tools, resources that are available to them when they need them in order to help them towards recovery. And that is truly what this strategy is all about. We know that the overdose crisis is complex. I don't have to say that to the people who are here in this room. You all know that. But we also know that it's a public health issue that affects us all. We are supporting Canadians by using a variety of tools from prevention, harm reduction, and treatment services. And we must continue to challenge the stigma and tear down the barriers that prevent people from getting the support they need. Because when we get the right support out there, what I do know is that there is hope. I recently heard a story of someone who sought support through the Safe Opioid Supply Program in Toronto and was able to secure a job, stable housing, entered school, and reconnected with their children. Step by step, win by win. Or another story that was shared with me of someone who described accessing injectable opioid agnostic treatment as, quote, being able to feel alive again and have a glimpse into what their future might be now. What their future might be now is that line of hope to healthcare, to better health choices, and a supportive journey that brings them back to families, loved ones, and the life that they deserve to have. This is the work that we need to do. This is the work that we need to do together, because there are so many stories like these from people who were able to rebuild their lives with the support from community organizations and healthcare providers. And that's the work that we'll be doing together with all of you. We're building a safer, healthier, and more caring future for all Canadians, one where we embrace one another in the journey towards healing, because we all matter. I want to thank everyone for joining me here today. Merci.
Thank you, Minister Stacks, for making this important and impactful announcement here today. I'm pleased to welcome to the podium now Karen McDonald, Director of Program Development and Operations at Unity Health and lead of Toronto's drug checking services.
Thanks, Sonia. Good morning. My name is Karen McDonald, and I lead Toronto's drug checking service, which is coordinated from within this very building here at St. Michael's Hospital, a site of Unity Health Toronto. I want to thank everyone for being here this morning, and in particular, I wanted to thank Ministers Sachs and Ien and Dr. Chapman. Almost 6 years ago, Health Canada's Substance Use and Addictions Program invested in 3 robust pilot programs to understand whether drug checking services could contribute to a reduction in harms associated with substance use. One of those programs was in Victoria, BC, one in Vancouver, BC, and one right here in Toronto, which came to be known as Toronto's Drug Checking Service. I have had the privilege of leading Toronto's drug checking service with support from many in this room, including Dr. Dan Werb, who you will hear from next. Toronto's drug checking service is a community-based public health service that allows people to submit a small sample of their drug to be tested and receive results about what's in it, along with tailored strategies to reduce harm and referrals to drug-related health and social services. Beyond educating individual service users, the program combines results from all of the samples checked to perform unregulated drug market monitoring, and then publicly disseminates that information every other week to inform those who cannot directly access the service, as well as care for people who use drugs, advocacy, policy, and research. Since launching in October of 2019, Toronto's drug checking service has checked over 11,000 samples and has shared almost 200 reports publicly about what's circulating in the unregulated drug supply. We have identified over 450 unique drugs, many of which can be directly linked to overdose. About half of the samples we check are what service users got or bought as fentanyl. And what we have uncovered is an unregulated fentanyl supply that is incredibly and increasingly contaminated and unpredictable. And it is precisely this contamination and unpredictability that is driving the loss of 21 Canadians each day. And I do want to stop for a minute and think about 21 Canadians each day. That's the equivalent to about half of us sitting in this room. Think about us trying to hold this exact same press conference 2 days from now on Wednesday, but none of us being left to participate. The drug checking programs Health Canada invested in almost 6 years ago have proven to have a positive and quantifiable impact on responding to Canada's toxic drug supply crisis. For example, we have learned that drug checking can lead to behavior change that reduces the risk of overdose. Drug checking provides a new gateway to accessing harm reduction services. Drug checking generates data that informs clinicians and care and improves health and social services. Drug checking empowers people who use drugs to advocate for themselves and contribute to the development of solutions that impact them. Myself and the member organizations that lead Toronto's drug checking service are incredibly fortunate to be receiving further support from Health Canada's Substance Use and Addictions program to scale drug checking services in Ontario. We will use these funds to improve access to this potentially life-saving service, to promote provincial monitoring of the unregulated drug supply, and most importantly, to contribute to bettering the lives of Ontarians who use drugs. Minister Sachs and Ien and Dr. Chapman, my team and myself cannot thank you and your teams enough for your continued collaboration and competence. Thank you.
Thank you, Karen. Next, I'm pleased to welcome to the podium Dr. Dan Werb, Director of the Center of Drug Policy Evaluation here at St. Michael's Hospital.
Thank you so much. Hi, I'm Dan Werb. I'm the Director of the Center on Drug Policy Evaluation here at St. Mike's. I want to thank Minister Sachs, Minister Ien, and Dr. Chapman for being here today to make this important announcement about further support to end the opioid and related drug overdose epidemic. So Canada is 8 years into an overdose crisis that is leading to more deaths, and it's driven primarily by fentanyl and other high-potency opioids. And unfortunately, 8 years into this crisis, the numbers are going the wrong way. So in Ontario, for example, more people have died of an overdose since this overdose epidemic began than have died of COVID-19. The people that die of an overdose are roughly half the age of people who have died of COVID-19. So when we're trying to understand this crisis, by that measure of the years of life lost, we're talking about a crisis that is about twice as bad as the COVID-19 pandemic. The other issue here is that unlike COVID-19, this pandemic began and we had no idea how to prevent the transmission of the virus or stop the illness that it produced. With overdose, we actually have the tools to end this epidemic and to protect people from dying. We have to provide people with naloxone, which effectively and immediately reverses opioid overdose. We need to connect people with treatment and care for their substance use and for their health needs. We need to provide harm reduction programs like supervised consumption services to protect people while they are still alive and to act as a gateway to help them improve their health and social well-being. And we need to implement drug checking services, which can provide people, as Karen described, with life-saving information about the drugs they are using so that people can arm themselves and their communities with knowledge that can help keep them alive. So on drug checking, one of the ways we've been working on expanding access to this life-saving intervention is by developing DoseCheck, an inexpensive and portable drug checking technology developed in partnership with people who use drugs, community health centers, and government agencies like the US National Institutes of Health and Health Canada's Substance Use and Addictions Program. DoseCheck is a handheld device that connects to a free smartphone app, and it's designed to allow anyone, you don't need any training to do this, anywhere to rapidly test drug samples. It then allows people to use their smartphone to anonymously share the the information from that test with other people in their geographic region through the smartphone app, and thereby protect communities. Dose Check is designed for communities and people that can access gold standard programs like the one that Karen McDonald has built here in Toronto. And we are working closely with partners across Canada, and I'd note particularly in Northern Ontario, where the per capita overdose mortality rate is 3 times the Ontario average, to complement those efforts and to really democratize access to this life-saving intervention. All Canadians should be able to arm themselves with life-saving information about the toxic compounds circulating in the unregulated drug supply. We hope Dose Check can help do that. And so I want to just thank Minister Sachs, Minister Ien, Dr. Chapman, and Health Canada again for supporting the development of new accessible technology, while also supporting public health interventions and programs like the Toronto Drug Checking Service that can all help save lives and act as part of a much larger strategy to end this preventable overdose epidemic that is raging across Canada, and which we have a moral obligation to end. Thank you very much.
Thank you, Dr. Werb. Finally, I'm pleased to welcome to the podium Dr. Leigh Chapman, Chief Nursing Officer of Canada.
Good morning. Bonjour tout le monde. I'm delighted to join Minister Sachs and colleagues here today for the SUAP announcement and presentation of Canada's renewed drugs and substances strategy. I was appointed into the Chief Nursing Officer role in August of 2022. And since that time, most of my work has been focused on health workforce issues impacting the nursing profession specifically. For example, nursing retention as a means of improving the working conditions for nurses in Canada. This work is essential to ensure equitable and accessible healthcare for all. In addition to my role as Chief Nursing Officer, I'm also a harm reduction nurse here in Toronto Centre. I work at a supervised consumption and treatment site, a position I've held since 2019. And I've also worked in the area of harm reduction since 2017 through my involvement in the Toronto Overdose Prevention Society, work that I'm very proud of and work that is very near and dear to my heart. And I'm also a bereaved sister. I lost my brother Brad in 2015 when he overdosed on Walton Street, just 500 meters from here, and died a week later in hospital. So when I hear the statistics of people dying every day from overdose in Canada, I know that those numbers are people. They are people with rich lives and stories whose deaths are preventable. They are our family and friends and our loved ones. Brad was a son, a father, a grandfather, and a brother, and I grieve his death every day. I've also seen firsthand the life-saving impact of SUAP funding through many community-based initiatives. It's often been said that the opposite of addiction is connection, and it is these life-saving, life-affirming connections that are game changers in the world of harm reduction. I'm so pleased to work for a government that gets it when it comes to harm reduction, that harm reduction is healthcare, that understands that there are multifaceted ways to target this complex problem, and that we must listen to the perspective of those with lived and living experience because they know best what is needed. There is always more that can be done, but compassionate, life-saving interventions are not up for debate. Evidence-based strategies should not be contested. I truly believe that when it comes to harm reduction, compassionate, collaborative, and evidence-based care can only be achieved by listening to the voices of those who are most affected by this toxic and illegal drug crisis. The SUAP funding announced today demonstrates this government's commitment to a ground-up, community-based approach to supporting people who use substances. I want to thank Minister Sachs for her compassionate leadership on this topic and everyone here today for your leadership and professionalism in this area. It is life-saving. Thank you. Merci.
Thank you, Dr. Chapman, and to all our speakers for being here today for this exciting announcement. I will now hand it over to our moderator, who will invite questions from the media.
We will now proceed to questions from journalists in the room. Please state your name, media outlet, and whom your question is directed to. You will have the opportunity to ask one question with one follow-up. Nous allons maintenant passer aux questions des journalistes présents dans la salle. Veuillez indiquer votre nom, votre média et le destinataire de votre question. Vous aurez la possibilité de poser une question avec un suivi. Let's proceed to the first question. Nous allons passer à la première question. Thank you. Merci. We will pass to the Zoom now for any further questions. Nous allons passer à Zoom maintenant pour toute autre question.
Thank you. If you're a journalist on the Zoom and wish to ask a question, please use the hand-raising function. And please state to whom your question is directed. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, vous utilisez l'option de lever la main. Et merci d'indiquer à qui vous posez votre question. We have a question from Marina von Stackelberg with CBC News. Marina, please go ahead.
Good morning. My questions are for Minister Sachs. My first question is, this is an updated Canada drug and substance strategy. So what is significantly different here?
Hi, good morning. Thank you for the question. So, as mentioned in my comments, what's significantly different is that we are taking a full, holistic, all-of-government approach to the renewed CDSS. So, as I mentioned, 15 departments will now be involved in anchoring the 4 pillars of our drug strategy, which includes prevention, harm reduction, treatment, and enforcement, because we know that we have to really pull everyone together, whether it's my colleague Minister Ien, who's here today on the youth file, but also housing and so many other pieces to the puzzle that will ensure that a full continuum of care is available for those who are struggling with substance use.
So for my follow-up, so if I understand correctly, the pillars are the same. Have you changed how you're approaching harm reduction, and in what ways?
So harm reduction, as mentioned by many colleagues here today, is healthcare. We see it as a key component of the many tools and strategies that we are using to help those who are most vulnerable and struggling with substance use. But it is an evolving practice. We are constantly challenged of looking at new tools, to be invited to try new innovations, such as those that Dr. Werb mentioned today. We need a full suite of tools in harm reduction, treatment, and prevention. And by really integrating our work interdepartmentally and looking at a broader approach to what a continuum of care looks like, harm reduction is a key component of that.
Thank you. There are no further questions on the Zoom, so that will conclude the conference. Thank you for your participation. Any additional questions can be directed to Media Relations at Health Canada. La conférence de presse est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à Santé Canada. Merci et bonne journée. Thank you and have a nice day.
Recording stopped.